Hello, my name's Andrew Blaikie. I'm an ophthalmologist based in Scotland and lead for the Arclight project. We've been working with CBM Global Disability Inclusion on bringing inclusive primary eye care to remote communities in low and middle income countries using innovative portable off-grid eye care technology. Worldwide, an estimated 2.2 billion people experience poor vision, and the majority of these cases are preventable or treatable. Many regions are impacted disproportionately, particularly South Asia and Sub-Saharan Africa. A major underlying problem is that in low-resource countries, lack of access to treatment and late diagnosis leads to needless blindness, and in the case of children with retinoblastoma, death. Lack of trained and equipped healthcare workers, especially in remote rural regions far from the big cities, underline the need for a more cost-effective and integrated approach to delivering eye care. There is increasing evidence that to achieve this integration, a wider array of health professionals should gain knowledge, skills and equipment to be able to work together more collaboratively to deliver eye care. As a consequence, the World Health Organization launched the Primary Eye Care Agenda. Primary eye care brings diagnosis and treatment close to home, avoiding the often insurmountable barriers to care, offering equitable healthcare for persons marginalised with disabilities. Local provision of eye care is now possible as CBM Global deliver the cutting-edge Arclight technologies with training and distribution of devices close to where people live at community level in primary care centres. This is how CBM Global and Arclight project are making a difference. Traditional diagnostic tools are expensive to buy, hard to maintain, and once broken, or even just out of batteries or bulbs, are left redundant in the graveyard bottom drawer of eye clinics and wards. Diagnosis and treatment close to home, to avoid the often insurmountable barriers to care, is now possible due to the innovative Arclight technology and training package. Combining cutting-edge and appropriate Arclight technology with training and provision of devices close to where people live, at community level in primary eye care centres, is how CBM Global and the Arclight project are making a difference. The Arclight solution is a frugal, solar-powered, user-friendly device equipping healthcare workers in remote areas to combat eye and ear diseases. It's a pocket-sized, all-in-one ophthalmoscope, anterior segment loop and otoscope with a strong scientific evidence base that demonstrates the package to be just as effective as more expensive traditional tools, but with many advantages. It's low cost, it's highly portable, it's robust, it's independent of hard to find and expensive consumables, easy to use, and most importantly, it works just as well. Research studies published in some of the world's top scientific journals, including the British Medical Journal and Eye Nature, show very clearly that despite the frugal and simplified design, the performance of the Arclight device is equal to, and in many ways surpasses that of orthodox tools that are vastly more expensive. There is consequently no compromise adopting the Arclight package into eye care service in low or even high resource settings. In addition, it is unique in being able to be attached to the camera of a mobile phone for remote second opinions, recording baseline clinical status, and acting as an entirely new and innovative way to teach eye care, not just in resource-poor settings, but also in higher resource training schools. To support effective implementation of the device, CBM Global have recently delivered workshops through their programs in Malawi, Zimbabwe and Kenya. Using the Arclight device, along with simulation eyes, videos, mobile phone-based apps, posters and coherent handouts in interactive workshops, we've transformed the way we can deliver eye healthcare to those working at the front line. With all training materials available free for download from the Arclight Project Primary Eye Care website, other organisations can deliver workshops similar to ours to equip and empower their healthcare workers. Our training programmes typically start with a 2 to 3 day training the trainers course where the eye care professionals receive a refresher, an update on eye care examination techniques, but at the same time gain the knowledge and skills to deliver primary eye care workshops independently. Simulation eyes, mobile phone-based apps are an innovative way to safely practice diagnosing a range of eye conditions, developing self-confidence before engaging with patients. After classroom-based interactive tutorials, the participants moved to a clinical environment, using the tools on real patients, developing their clinical examination skills using the Arclight tools. These include how to assess visual acuity, check pupil responses, examine the front of the eye, perform the fundal red reflex test, and look into the back of the eye to diagnose diseases such as glaucoma, diabetic retinopathy, infections, and retinal detachment. Here is one of our trained trainees, Solomon from Kenya, giving quick feedback.
The methods that were used were so educative, they were so new to us, and the students were able to learn a lot and were able to grasp a lot of skills from that course. Thank you so much.
Once the trained trainers have completed the course, they go on to deliver half-day workshops to community level and general nurses, focusing on the curriculum of the Primary Eye Care Manual for Africa, developed by the World Health Organization. In collaboration with the Arclight project, CBM Global is making strides in inclusive eye health. Together, and with local partners who are training and equipping government healthcare workers in health clinics and district hospitals throughout East Africa, and, as a result, giving access to life-changing cataract surgery, spectacles and laser treatment to many patients who'd otherwise be entirely marginalised. Here is one of our lead ophthalmic clinical officers from Kenya, Afid, explaining the benefits of the Arclight.
Okay, thank you very much. This is an Arclight. It's an equipment for screening eyes, and it's an amazing one. You can use it. You can use it for screening the eyes. You can use it as a slit lamp. You can do fundoscopy, and instead of a big direct ophthalmoscope, this one is working amazingly. It is a nice equipment, very light, portable, and it doesn't break easily. Also, it doesn't have the cost of power like buying batteries all the time. I've found it to be amazing equipment. Yes.
So what's next in disability innovation? Well, we see a future where creative, thoughtful, and frugal yet effective technology can be used to train, equip and empower healthcare workers at all levels of the healthcare system. This will be by bringing together 4 strands of innovation: new educational strategies, artificial intelligence, working with immunisation programs, and delivering even more cutting-edge new diagnostic tools. We envisage integrating interprofessional education eye care models into training schools, developing both in-service as well as pre-service programs. Using interprofessional eye care education strategies recently developed and evaluated in a PhD program in Rwanda, different cadre of healthcare workers can be taught together, learning with, from and about each other to improve collaboration and the quality of eye care services in the healthcare system. We are also currently creating an AI assistant called Alan that exploits the stunning potential of ChatGPT-4 to prevent blindness. Alan is a mobile phone-based system who's able to support and mentor healthcare workers towards a differential diagnosis and management plan through considering history and examination acquired using the Arclight package. In addition, the World Health Organization recently recommended eye examinations for the first time in the newborn examination. This is a result of the strong evidence base of the Arclight device in performing this test effectively, yet at low cost. We consequently aim to work closely with those delivering immunisation programs to identify cataract and retinoblastoma earlier, preventing a lifetime of blindness, and in some cases death. In addition to the Arclight direct ophthalmoscope, we have developed a more sophisticated binocular indirect ophthalmoscope. This tool delivers a wide field of view for diabetic retinopathy and retinopathy of prematurity screening. And we've created unique hemispherical simulation eyes with the signs of both diseases in them to allow us to train and then assess healthcare workers to see if they have achieved competency. With these tools, we have delivered pilot workshops now in Kenya and Indonesia. And in Indonesia, we've also compared the screening accuracy of our device to expensive digital cameras with exciting results. And so in conclusion, thank you for allowing us to share our journey with you. We hope you can now join us as we continue to drive change through innovative technology, creating a more inclusive world where equitable access to high quality yet low cost healthcare is possible.
It's okay.